Stress is a reality of life, and we always go through stress. Adult, children, all the time.
We are here this morning at Enid Bennett High School in Bog Walk, St. Catherine, and it's another of our Ministry of Health and Wellness in collaboration with the Ministry of Education intervention within the school system to help our young people, our students, understand stress management, to provide some psychosocial support, to help them basically to manage stress, manage distraction, manage negative energy. And it's something we're doing right across Jamaica. So today we said to the children, basically, they need to find their safe space. And we broke it down. A safe space is somewhere you can go to get comfort. You can go to think. You can go to get advice. You can go to avoid conflict. You can go to focus on the right things. And we have unveiled here another wellness bench, which we're doing in a number of schools. It's practical because you can use it. It's going to be here at the school, but it's also symbolic, meaning it represents the safe space. Similarly, so we have the stress balls. This is just an event. We need a process. So we appeal to parents at home. We appeal to other adults in the population to help these children to recognize their potential, to be positive about life, and to overcome any obstacles that they face. And that's what we do here at Enid Bennett.
Stress is a reality of life, and we always go through stress. Adult, children, all the time. And so we have various programs. I welcome the move in schools, and I know that a program like this will help our students to really deal with conflict, deal with their own situation, have a safe space. When they get hungry, upset, they can cool out and relax. Our school is very big on moves in school. We have our water day, we have our fruits day, we have our 5 minutes break at times. We and moves in school day, we have our mini Olympics. So we are always big on the exercise and on the wellness. A matter of fact, some years ago, even before this wellness started in school, my dream is to make the Enid Bennett High School a wellness center. And presently, I have a teacher's cottage where I want to transform, and I hope the Ministry of Health and the Minister partner with me to transform it to a health and wellness center, whereby one day we can have a medical doctor coming in. One day we have the optician, one day we have the ophthalmologist, one day we have the psychiatrist, one day we have the psychologist, one day we have the RGD people coming in. Because what I've noticed is that quite a number of children coming to the school do not have birth certificates. And so they would have been failed by the society because the parents would have failed them. They go through basic school would have failed them. They go through the primary school would have failed them, and we don't want to fail them at the high school. We have our guidance counselors and different persons, like we use a guidance clinic and all of those to help our children deal with the different issues that they have to do.
So you mentioned that stress is a reality of life.
Yes.
What are you picking up among your student population? How is this affecting them? How is it impacting on their learning per se?
Students in general, when they are stressed, they tend to be angry, they'll get into fights, they'll show signs of truancy, they try to dress a certain way to seek attention. So this is a general feature among young people, not necessarily the Enid Bennett High School, but generally. And so we as educators have to ensure that we minimize the stress level for the student. And you know, one of the big issues that we have, there are times when the students come to school with the stress, and let's use the term, fix them. But guess what? They go back into the environment where the stimulus are. And so there are a number of stimulus. And so they go back into the stress. So it has to be like a recurring decimal. They come, we fix them, they go back. They come, we fix them, they go back. So it has to be a concerted effort to really reach out to these students.
This is one of many school visits that we are making this year. It's what we call a school wellness check-in. We had a series of those last year, and we're doing it this year, prior to the children going out for the summer holidays. We want to check in with them. We want to give them some, points in terms of keeping mentally well for the holidays, trying to ensure that they come back to school in September in the best shape possible to really, absorb what they're being told. When Minister speaks, he kind of gives a kind of broad outline of how to deal with stress. Save space, coming to the bench, using the stress ball, finding somebody you can talk to. And then what we do after Minister leaves is that we have a smaller session where children who are having more challenges and need maybe greater intervention, we gather them together and kind of speak in depth with them for a 2-hour session to see if we can intervene more deeply and help them more.
What we are seeing post-COVID is a lot of deviant behavior, and the Minister of Education has spoken to it. We have seen it, and some of that manifests itself in the accident and emergency room. Some of it manifests itself, unfortunately, a very few, but one too many, in the morgues, where students have actually died in conflict. Some of it has manifested itself in the classroom for non-performance. Some of it in the playing field for deviant fights, and then people needing counseling. So we have launched a number of programs. One, for example, is Problem Plus, which is to mobilize community leaders to assist in helping people to overcome problems in a psychosocial way. If it is bad, then it's elevated to a psychiatrist. But we believe that it starts simple, and if we can intervene at that level. We have also trained over 500 educators in schools to help to recognize students who are having issues and supporting them. It has cost us, but it's a worthwhile intervention because our children are our future and we have to work with them.
How many schools have you hit so far with this program?
I have personally been over the last month to about 4 or 5, but I know that throughout the regional authorities, there are interventions that are being done on a daily basis.
Have you received a feedback as to how well the program has been going?
I think the reception is good, and I think the education sector, the teachers appreciate the intervention, and they have said so. The principal just said it a while ago. So it is a positive response, but again, it takes a village. So we really have to keep pressing and keep getting as many people involved as possible.